Hey, Dr. Cernick, I want the best joint replacement I can get. I'll pay anything.
Okay, so most people that are trying to shop for a joint replacement are hoping that it's going to last really long. There's other things to consider as well, depending on what kind of joint replacement it is. Things like range of motion, stability for, say, hip replacements. I think that the way I would make these decisions is typically I would choose the surgeon first. Once you've chosen a professional that you trust and you feel is the right person for you, who you feel you can work with, the next thing to do is probably let that person select the joint replacement. The reason I say that is because when we look at big studies where we track joint replacements over decades, the joint replacements that typically last the longest often are the ones that are put in by surgeons that are using the same device in high volumes. Every device has its kinks and its benefits and its tips and tricks for getting a good result. And so if you do these thought process in the reverse order, take the device first and then try to encourage a surgeon to use something they're unfamiliar with, they're probably not going to get the results that you want. It's much better to have the surgeon pick something that they're familiar with, that they understand, and put in high volumes. And so that's probably a generic answer to how do you get the best joint replacement. Well, you probably have that match between surgeon and device. But I would lean heavily on the surgeon to use the device that they're comfortable with, and then pick the surgeon that you're comfortable with.